Good afternoon. I'm Dr. Eric Toring. I'm the Senior Vice President for the American College of Veterinary Preventive Medicine, and I would like to welcome you to the webinar this afternoon. Today's webinar is sponsored by the American College of Veterinary Preventive Medicine and its sponsor organizations, the National Association of Federal Veterinarians, the American Association of Food Safety and Public Health Veterinarians, the National Association of State Public Health Veterinarians, and the U.S. Animal Health Association. I would like to introduce our speaker today. Dr. Stephanie Ringler is a veterinary medical officer for the National Sheep and Goat Team with USDA APHIS Veterinary Services. She graduated from The Ohio State University in 2011 with a bachelor's in agriculture, and then she completed a master's of public health degree at Louisiana State University in 2013. Following her MPH, she worked as a veterinary entomologist at LSU and then began her veterinary degree at LSU in 2015. In addition to working for USDA, she owns and operates a small ruminant veterinary practice in Western Pennsylvania, where she educates, trains, and provides medical treatment to sheep and goat owners in the community. In January 2023, Dr. Ringler was recognized by the American Association of Small Ruminant Practitioners as their 2023 Emerging Leader, which has allowed her to create biosecurity materials that can be used by small ruminant veterinarians around the country. Welcome, Dr. Ringler, and we look forward to your presentation.
Hi, thanks so much for that introduction. I'm excited to be here today. Today we're going to be talking about Q fever. Are you and your clients at risk? And so who are your speakers today? As your facilitator, I'm here with USDA APHIS and the sheep and goat team, but we also have Cricket here, who's a Connecticut dairyman and advocate, Dr. Allison Weidenhef, who is with USDA APHIS NOMS, and Dr. Jason Lombard, who is also with USDA, but now with Colorado State University. So we have a really great group today, and I hope you guys bring questions. So our goals for the discussion. So our goals are to discuss the importance of Q fever among farmers and animals in the U.S., to provide guidance on Q fever and how you can assist your local farms, and determine how we can mitigate the risk of Q fever and spread awareness on the disease. I do want to mention that this topic came about a year ago. I had realized I was getting a lot of questions from state veterinarians and public health offices on what do we do next. We have this farm that's positive. We had this, goat tested. The owners were worried. And since states act in different ways with their response, I felt like there was a lot of unknowns there, and I wanted to find a way to help people. And that insert Cricket, he had met with Jason Lombard at a meeting and had said, hey, this happened to me. I want to get more awareness out there about it. And this kind of led to starting this project. And so because of Cricket and his want to advocate for people in his situation, this is why we're here today. So I really thank Cricket for being here. So Cricket's going to give a little bit of his story and talk about who he is. So Cricket, is a son, he's a husband, he's a father. So why, after being a dairyman for his entire life, was he not able to get out of bed? Why was he not able to do the job that he loves? He loves his cows, he loves his family, but he wasn't able to provide for his farm anymore that had been running with his grandparents since 1948. So he's kind of here to talk about how this has affected him. And he's not the only one affected by this. After we published our Hordes Dairymen paper last year, we were reached out by tons of dairymen who had the same story, who said, I was diagnosed, but I couldn't get help, or it took me months to be diagnosed. And so we're so glad to have you guys here today to listen to this story and to hopefully have a call to action to get you guys to help us further this awareness moving forward. So Cricket.
All right. Well, thank you, Stephanie. Thank you, everyone here on the call, for being here this evening to really, hopefully I could spend the next 15, maybe 20 minutes just kind of pulling together a summary of thoughts around Q fever and how it affected me, and give you some background here that I think is going to be, and hopefully very useful for you to take with you, and we can take some action here. So first of all, again, I'm Cricket Jack here, a dairyman from Connecticut, who has been very active on a dairy farm. When I say that, I would just say this. I think I'm like you all veterinarians, where 18-hour days couldn't slow me up. Nothing would slow me down. Seven days a week. It was work, and it was work with cows. And I was the cow guy, right? I just lived and breathed cows. I would get the phone call when there was an extreme calving case, something like that. I did everything but the C-section, if you will. So, when I called the vet for a calving case, they knew it was really going to be a troubling situation, right? So from there, from the cow side, reproduction was really a main focus for myself. I do quite a bit of ultrasounding myself, that kind of thing. So the reason I say that is I'm working on that end of the cow a lot, working with calving cases, and that's an area where that Q fever can certainly be prevalent and all of that. And in addition, I am very involved with the dairy industry nationally, maybe through National Milk, our dairy cooperative as well. Got the chance to catch up with Jason at a meeting, and we're talking about zoonotic diseases, and it's like, hey, oh, by the way. So great to kind of, I think, tell my story here a little bit with you all. So I would just say to start off, if we go to the next slide, we started with how do you get a diagnosis with this? But it was really the COVID era that brought a lot of everybody that jumped to the conclusion, I think, pretty quickly during that time frame, as anybody came with very complex issues that they were dealing with. And for me, I work very hard every day to protect the employees. We're 7 days a week. We can't stop. We've got to be there. We're the frontline people, right? But and nobody's going to take this guy down. But in 2022, early 2022, I was diagnosed with COVID, and it was at the tail end of COVID, I thought, and everybody else that seemed to have had it around the farm a bit, and we've all been able to get through, if you will. And being the tough guy, I was one that was hit the hardest. And certainly, I was home in bed. Not a big deal. But it got to the point where, I had that extreme muscle pain. I called it bone pain. Everybody, it was bone pain. It was finger pain. It was wrist forward pain. It was knees down pain. And it was constant 24/7 ankle pain. And it was in my joints. And okay, this is this is COVID. This is all of the things that can happen and all this and that. Well, this went on for quite a long period of time, and I had tested negative for COVID, and I had other symptoms that were coming up, but it was COVID. So to be honest with you, pretty tired of going back and forth to doctor visits, as we probably all been through some of these situations, and can't get that diagnosis that it must be more of a long haul COVID. So if you go to the next slide, I'm really, there's a lot of pieces to this, but I was at a point of where I felt like I could get around. I was able to walk again. I was about 2.5 to 3 weeks pretty much bedridden. And if this guy's bedridden, I'm just telling you, it meant something. And it was something I had no control over. But I was able to get up and get around, really getting sick of being home. And so I attended a meeting, as an example here, a dairy industry meeting. And I just got to cope with this. I was through to COVID and all of that. Long story short there, the fatigue was so extreme, I had kind of blacked out. I was taken to the Mayo Clinic. Oh, they thought I had a blood clot. I drove home from Phoenix to Connecticut. They wouldn't let me fly, those kinds of things. They really couldn't pinpoint what was going on, other than I had these lingering long haul effects of COVID. So that was really the diagnosis, if you will, that I was working with, and had not much else to go by. And so which moves us into the summer months of 22, which, I was everywhere. When I say that, I've been to, Yale New Haven Hospital. I was at Boston General. I got to a point in the summer where my breathing, my respiratory was affected. To explain my situation, it was as soon as I went to talk, something would suck all the air out of me and I couldn't breathe. So I went about 3 weeks where I could not talk because it just instantly stopped my breathing and it was significant pain in my chest. And I couldn't explain and I couldn't get anybody to understand this symptom. It was, I was this science project, if you will, but I was obviously pretty seriously affected, which they again thought was long haul COVID. And some of this is just maybe some neurological type reaction type things. They could not figure out what was going on. So, I don't want to dwell really on the bad things, but it's a disease that is crippling. It is a disease that exposes itself in so many different ways that each individual person obviously is always different. But whether the the COVID bringing down my immune system just extrapolated the instance here. I can't put all of these pieces together, but the fact of the matter is, even when somebody gets like a cold and our immune system goes down and you're dealing with Q fever, I'm telling you, it's not something that you're gonna, it is something that you're gonna take note of pretty quickly. From there, I can tell you another symptom that was scary was my lymph nodes in my neck blew right up. I can tell you they thought I had MS. They thought I had another form of cancer. They thought I had, you name it, everything but a diagnosis that confirmed. So I met in August of 22 with an infectious disease doctor because nobody else could kind of send me anywhere. They couldn't figure out where to send me to. And I just so happened got lucky with Dr. Abriola, as I explained to him, who has no experience around really cattle or cattle livestock. But I really dwelled on the fact that I was a farmer. I'm exposed to a lot of things. Yes, I had COVID, but boy, it really seems like, there's something else going on. And, I don't know what gave the signal to Dr. Abriola to send in a Q fever test for me, but the first blood test that they drew on me, which takes a couple weeks to get back from testing, I was positive Q fever. So we all know on a Friday afternoon when the doctor calls you and says, I need to see you kind of in person kind of thing, I knew that it was pretty significant. This was a zoonotic disease. He says, I have absolutely no experience. I don't really know what I'm talking about. We've got to think about this over the weekend, and I'll see you kind of next week. So that's really where it was left with that. And, other things that really rise to the top for me, because I think if you do a little research on this with humans, fevers are a big one that shows up. I can tell you, I don't know if I really had even fevers weren't my big symptoms. It was all of this other stuff, if you will. And cold and hot temperatures are two very important triggers for me. I get extremely cold way before everybody else. And in the heat, it's overpowering for me, those types of things. So I have adjusted kind of my lifestyle a bit to really trying to take stressors away from me to help bridge this gap of not letting my body get down. So those were some other things. So to kind of maybe put a little bit of a wrap on this diagnosis, I have a few things I'd like to leave you with. And that is, once I had the diagnosis, the most influential research that I had, that my wife actually did for me, was the Q Fever Facebook group. If you go on there, I learned everything I know about Q Fever, to be quite honest with you, because they'll tell you there's not one doctor in the US that has 2 patients with this. That's what I was told. Once you have Q Fever, you're not going to ever rid it. You have to deal with it. You're going to have to learn to live with it. So I knew this was pretty serious, but got my doctor to put me on doxycycline. So kind of like a tick-borne type thing. I was on a couple hundred milligrams of doxycycline for a year and a half, by the way, continuous for a year and a half dealing with doxycycline. I was on hydroxychloroquine. I've been taking CoQ10 supplements. And I was going every couple months to get blood tests to measure my titer for Q fever. So I've been able, and it's moved up and down, a little bit down, but it's stabilized at this point. That's kind of and it's been about 4 to 5 months since I've had a last test. So that's kind of bringing me up to really the current status of where I am with Q fever. And once I've done, we did the Hordes Dairyman article, all of a sudden aha moments are going off for people. And I now have 5 people that I know of within 40 miles of my farm that have been diagnosed with Q fever, mostly from the article and the outreach about this, have sought treatment, and I hope are getting early intervention. Because this disease, I'm told, has the ability to attack, it attacks major organs in your body. It'll hit the heart, the liver, the kidney. It's going to hit something, more than likely, is what I was told. So I have been through rigorous testing through all of that, if you will, and I have to continue that on a go-forward basis. So my goal here is pretty simple. I think this disease is complex. I think this disease is very underdiagnosed. I called up my herd veterinarian when I was diagnosed, and I said, Mark, I says, I can't believe it, but I have Q fever. Have you ever heard of it? And the response was, wow, I'll bet you there's a very large percentage of your cows that would test positive Q fever. The human, the cow to human interaction, maybe not so much, but I didn't realize that this was out there as prevalent maybe, or undetected, and maybe didn't know how easy it was or hard it was to transfer to human, but it can. And when you go on the Facebook group and I see pockets across the country, excuse me, there's pockets across the country, and I can just know from the Q fever group, Central California, San Joaquin Valley, like there's quite a bit of activity in that area. And obviously in Australia, with the sheep and the goat, there was a much more of it over there. But that's the only my only resource to kind of help me walk through and help my doctor with this. So my goal is exactly this: do the outreach with you folks. I think this needs to be moved higher on the radar. I think in the dairy community, I owed it to all of my dairy friends and from veterinarians and dairy farmers. And we've got to get this disease, I believe, higher on the radar with our health professionals to get early testing, early diagnosis, so that farms, we get some treatment. So because this is an extremely challenging disease to live with on a daily basis. So with that, I think I've kind of summarized how I wanted to share my story here a bit with you. There's a lot of pieces to this. I'm open. I want to be very transparent about this with folks, as you can tell. I'll answer any questions, and thank you for giving me the opportunity to share the story with you all, and look forward to the rest of the presentation here tonight. Thank you.
Yeah, thank you so much, Cricket. And I'm already seeing questions coming in. So I think that after the presentation, I think that more people want to hear more of your story and other questions that they have on your diagnosis. Moving forward, we are going to talk about the basics of Q fever, what it is, and moving forward for our outreach. So what is Q fever? As Cricket mentioned, Q fever is zoonotic. It's caused by an obligate intracellular gram-negative bacterium known as C. burnetii. It's environmentally hardy and highly infectious, making it a potential biological weapon. Q fever is known as coccidiosis in animals. So who is at risk? Most human infections are associated with small ruminants, but cattle can be a source of infection along with cats, dogs, ticks, and other animals. I thought it was interesting reading some of the information in Australia that kangaroos and wallabies and other animals in Australia also transmit it. So occupations at risk, farmers, shearers, slaughter plant workers, stockyard personnel, livestock haulers, and veterinarians. Obviously, this is not a comprehensive list, but just to give you an idea. So how is it spread on farms? So it's infected livestock may shed the organism in their milk, urine, feces, and birthing fluids. So this infected pregnant ruminant can shed high numbers of this organism at birth or during an abortion, especially in the amniotic fluid in the placenta. So when it's being expelled during the birthing process, it poses a high risk to exposure to other animals and humans, which is why we'll kind of talk about it later for biosecurity. The bacteria can survive in the soil and dust for years and can be spread over several kilometers by the wind. So this is a graphic from the Australian government. It's showing how Cibernetti can be dispersed across the farm into the city. I know that I read a lot that in conditions that are dry, dusty, and windy, such as the Australian outback, can spread the bacteria to other locations. And so it just kind of depends on these factors that they have, the ruminant species, vegetation barriers, stocking density, fomites, animal products, or transfer of livestock. So clinical signs in humans and animals. In humans, Q fever usually causes a flu-like illness, which can be severe. A person could experience high fevers and chills, severe drenching sweats, painful headaches, or extreme tiredness. As you heard Cricket's story, he talked about his extreme pain. He was also very tired. So he had some of these symptoms as well. And these symptoms can be acute or chronic. For animals, they do not appear to be sick. Cibernetti in animals can cause abortions, particularly in goats, stillbirth, infertility, or pneumonia. So a sharp increase in the number of abortions in your animals may be a sign that Cibernetti is on the farm. Diagnostic techniques and interpretations. So while testing samples from an individual animal may offer insight into the disease status of that animal, serology results are meant to be interpreted at the herd flock level. And, you know, in my research, again, there are issues with diagnosing Q fever from the animal side, and that's something that we hope to work on in the future. PCR is highly sensitive and specific, making it a testing method of choice for it. Culture is avoided because it does need to be in a biosafety level 3 laboratory. Additionally, we have ELISA, which can help determine herd and flock prevalence of exposure to the agent and support for clinical case. And then for human cases, they are diagnosing individuals through IFA. So in the USDA, you may be aware of NLRAD, the national reporting. And so under that case classification and surveillance, we have a suspect case, a presumptive, and a confirmed. And so these are the definitions of what you'd be looking at, especially if some of you are public health officials. So for a susceptible animal with clinical signs consistent with infection with Cibernetti, or a history consistent with infection with Cibernetti, or epi information indicating potential exposure to Cibernetti, which may include linkage to human Q fever cases. We did update these case classifications very recently. We had a Q fever veterinary services guidance out there for years, and we were able to update it so that this could include more suspect cases. For a suspect case with a positive on at least one Cibernetti screening test, so histo, diagnostic staining, and PCR, or serology if clinical signs are present and other causes of abortion have been ruled out, that would be a presumptive positive case. And for a confirmed positive case, it would be a suspect case in isolation and identification of Cibernetti, or Cibernetti has been characterized by whole genome sequencing. Currently, surveillance is passive, and it's reportable in most states. So although APHIS does monitor Cibernetti and other diseases. However, since many potential cases aren't tested or reported, our numbers are likely much lower than the actual cases present in the US. So this is why we really rely on producers, practitioners to let us know, if there is an active infection or outbreak. And we'll talk later about how you can contact USDA Veterinary Services to help you with kind of the investigation and controlling the disease. So with me today, we're going to have Dr. Jason Lombard from Colorado State University talk about relevant data related to dairy cows. So Jason shares an office with me, so he's going to talk right now.
Well, thank you for the opportunity to present. And I just want to go through a little bit of the data that's out there on cattle. So the first study that I've found really was looking at antibodies, so not PCR, but antibodies. This study that was done and published back in 2005. Shows that they surveyed 24 vet school associated dairy herds, and they had 22 of those that were positive via antibodies. So 92% of the herds, and the study said that, this is geographically widespread among dairy herds in the United States. There we go. So the next study that came out in 2005 was a bulk tank milk study again, but this was a PCR looking for the organism with PCR. And they did this over 3 years in New York State primarily, and then other states as well, and those are listed along the bottom. But what you can see is that 90% or more of the samples were PCR positive in every category, every year, every state that was tested with this study. So that brings us to 2007, and I see Dr. Gibbons-Bergner's on, and she actually assisted us when I was with USDA and we did the NOMS Dairy 2007 study. We collected bulk tank milk and did through Dr. Gibbons-Bergner at Wisconsin at the time. We did Cibernetti testing. We tested 528 herds in the top 17 dairy states, and you can see that we did see overall about 77% of all those herds were, that's actually a weighted percentage. So 77% is a national percentage of herds that had PCR detection, and that percentage increases as herd size increased. We also went back and looked at some of the health outcomes from our surveys on those herds, and we did find 3 things that were significantly different, primarily related to reproduction and health. We saw that those operations that were PCR positive in the bulk tank had a higher percentage of abortions or calves born dead and abortions, and then also a higher percentage of cows moved for reproductive problems. So at least in this kind of widespread study, we did find some health outcomes that were impacted by the status of the bulk tank. And at this time, it was kind of interesting to me. I didn't really have a lot of experience with Cibernetti at the time, and I'm wondering if 80% of our operations have it, and we know that people are consuming raw milk, not only at the farm level, but also the general public in cases where they can. Why aren't we seeing more Cibernetti in people? And I guess I thought maybe there was something different about the organism in cows than in sheep and goats, and maybe in milk versus birthing fluids. But I think and maybe some of what we're finding out now is that it was just really underdiagnosed as opposed to not a cause of disease. Here's another one that I think is pretty interesting: detection of Cibernetti in commercially available raw milk in the United States, published in 2010. They didn't look at very many samples. They looked overall at 21 samples from commercially available milk, and 43% of those were positive for Cibernetti. So there is exposure through the milk in our raw milk distribution system in the US. And this is really the last study that I found in literature from 2015. This was from Indiana, and you can see by the figure on the right kind of the distribution of the samples tested. They essentially tested herds in almost every county in the state. They ultimately sampled 316 farms and found about 61% of those samples or farms were PCR positive. And the reason I think this is a little bit lower than what we see nationally is that 90% of their samples came from herds that were less than 100 head. So we know that herd size is a risk factor. The larger the herd, the more likely that herd is to be positive for C. burnettii. And then I'll just leave you with these. This is a couple of documents that I think are helpful. One is by the National Association of State Public Health Veterinarians and State Animal Health Officials that talks about prevention and control of C. burnettii. It's 2013, so maybe getting a little outdated, maybe needs updated, but still a good reference. And then a consensus statement from the Journal of Veterinary Internal Medicine on the management of C. burnettii in livestock. And so I think both those are really good references for people that are dealing with this in herds. With that, I'll turn it back over to Dr. Ringler.
All right, thank you so much, Jason. Moving on, we're going to have Allison speak from the USDA APHIS NOM. So Allison, you can go ahead.
Well, it looks like my camera is not working. So we'll just move on without it. Huh. Okay, you guys can hear me okay, though?
Yes, we can hear you.
Great. All right. Yeah, so hi, my name is Allison, and I'm a CSU USDA cooperator, and I'm the NOMS Biologics Coordinator. I coordinated the biologics in the NOMS GOAT 2019 study that I'm going to be discussing here today. And next slide. Or do I have control over it? Yeah, good, thanks. The NOMS GOAT 2019 study occurred in 24 states. This represented 80.4% of the U.S. goats and 75.8% of U.S. goat operations with 5 or more goats reported. And we chose to focus on these operations with 5 or more goats to minimize the number of operations that would no longer have goats when we visited, and to ensure that the operations selected completed most of the management practices described in the questionnaires. Throughout our reports, we break down our data by regions, and here on the left, you can see the dark green blue regions are the western regions, and the lighter green are the eastern regions in the study. Additionally, the study had an enhanced focus on the dairy goat operation in order to better understand the management and biosecurity practices within the dairy goat industry. So we added states with a high dairy concentration in the study. Okay. Next slide. All right. So in addition to the questionnaires, this is where I focused my work on the goat study, was the biologic samples. The study collected fecal samples, blood samples, and swab samples. Here you can see the samples collected and the testing performed. For the C. burnettii, we used the serum samples that were stored in the serum bank, and we collected vaginal swab samples, and we did a PCR testing on those guys. Next slide. And here is a quick breakdown of the demographics. You can see that we collected from more medium operations, more operations on the East Coast, and slightly more dairy operations. And this breakdown generally follows the demographics we see in the goat industry. Okay. All right, here's the good slide with the results on it. This on the left, you'll see the serum and the vaginal swab testing results. The weighted C. burnettii seroprevalence in does 15 months of age or older was 14.5%, and there was 7.2% of the samples were considered suspect. 21% of the operations had at least one seropositive doe, and these operations had an average within herd seroprevalence of 21.3%. Operation and animal level seroprevalence were not statistically significantly different by the percentage of goats tested on the operation. And then on the right-hand part of the slide, you'll see the producer reported results. Only 0.8% of the operations had reported Q fever in their herd during the previous 3 years, and of those, 21.4% had the disease diagnosed by a veterinarian or a lab. just 2.6% of the seropositive operations suspected that their herd had coccidiosis in the previous 3 years. So this demonstrates an unknown risk for their own health and potentially the health of visitors or workers on their operation. So there's a lot on this slide, but the key points, Coxiella seems to be pretty prevalent and underreported. There is also a disconnect between the identification of the disease and the serology results. These results highlight the need for education and outreach on the topic, which could improve the economic and health outcomes for goat producers and on their operations. Okay. All right, so in addition to the seroprevalence and shedding results, we also did a regression analysis to look at the risk factors. Risk factors that increased the odds of shedding the bacteria included suspecting Q fever in the herd in the previous 3 years, wild deer and elk or predators on the property, and estrus synchronization. It is possible that operations that have more contact with wildlife in general would be more likely exposed to animals with supernatty. Additionally, the estrus synchronization may increase the number of susceptible does on an operation, allowing for the bacteria to spread more easily. We saw practices that reduce Coxiella include routine isolation of goats returning to the operation and requiring hand washing after handling goats with scabs. So this shows the importance of quarantining and the importance of general hygiene practices. We saw similar risk factors for the seroprevalence as well. Factors that increase the odds of a seropositive animal include suspecting Q fever in the herd in the previous 3 years, abortions in the herd, and no post-abortion cleaning performed, and operations that allow visitors access to kidding areas. Once again, this reiterates the importance of general cleaning and hygiene practices on operations and ensuring that visitors are kept in low-risk areas and are regularly washing their hands. All right, next slide. We also asked goat producers if they or anyone in their family have ever been infected with Q fever. Less than 1% reported that they have ever had anyone on their operation with Q fever. However, this is likely underreported. And as just an aside, I actually just had my Q fever titer taken last week because I was having some lung issues, and it did come back negative, but the doctors would have never thought to have tested me for Q fever. All right, next slide. All right, more results can be found about the GOAT 2019 study at our website, and that's at the bottom of the screen here. And on that website, you go to the GOAT link, and you'll see full-length reports and PDF versions, a Tableau dashboard that goes over all the results. You'll also see infographics and infographics. And we have also published a number of manuscript articles if you do a Google search for GOAT 2019. If you would like any of this material printed, we can also get that to you. Just let me know. I think that's it.
Yeah, thank you so much, Allison. And if you guys have any questions at the end, I'm sure Allison would be happy to take them. So we're moving on with our discussion today. I want to discuss how do we mitigate the risk to animals. As you heard from Allison and Jason and Cricket himself, there are ways to limit the spread of the disease. And so I just want to go through kind of quickly what those look like. And a lot of you as veterinarians understand what biosecurity looks like and what people should be doing. It's not that we can always get them to do it, but we can just really ask them, please do this, because it will affect your animals in so many different ways if you're not practicing some of these key items. So refrain from moving or selling animals, particularly pregnant animals or those that have recently given birth or aborted. To not consume, sell, or give away unpasteurized milk or milk products, limiting access to your farm, limiting access to animal areas, and prohibiting visitors to the farm. providing PPE to your workers, enforcing the proper use of that PPE, and demonstrating proper doffing procedures. And do not allow workers to leave animal areas without proper disinfection or disposal of PPE. Cleaning and disinfecting premises and dispose of carcasses in a biosecure manner. Refrain from moving or spreading bedding material and manure on windy days or spreading near populated areas, and implementing a rodent insect control on your farm. Again, these are all biosecurity items that are key to many other diseases, not just Q fever. So implementing one or all of these would allow farmers to, hopefully not get Q fever, but other diseases that are important that are zoonotic. So I did want to discuss through AASRP, the American Association of Small Ruminant Practitioners, I put together a biosecurity toolkit. These are just some example of the pages, and I will have the link for you in the final presentation, or you can go to AASRP to their website. So we have the building blocks of biosecurity, and these are handouts that as a veterinarian you can give to your producers, and it has a QR code where they can scan and go to the website. And so we just kind of talk about 6 building blocks, and these biosecurity practices are ones that I just mentioned in the previous slides. And as an example, we have practice good kidding and lambing hygiene, practice good hygiene. I thought I had other, hold on. And we also talk about, having a veterinarian on hand for their animals, rodent control, and limiting access to the farm. So these resources kind of make it easy for producers who may have trouble understanding a full list or requirements. You could give them these sheets and hand them out, and they can kind of look them over. I tried to make them, eye-catching so that producers and children would look at this and say, oh, wow, I want to read what this has to say. I want to learn more about this so I can help my animals. So how do we mitigate the risk to humans? So we need to be mindful that we do have a risk during birthing, butchering, and slaughtering of cattle, sheep, or goats, or handling newborns. We need to wear PPE, protective clothing, and a mask, especially in those activities. We need to cover our cuts and wounds with waterproof bandages, especially when we're handling animal products, waste, placentas, and aborted fetus. Wear a mask when you're mowing areas contaminated with animal feces. Wash your hands and arms with soapy water after handling animals and animal products. Do not eat or drink or smoke while handling animals or animal processing areas. And do not drink unpasteurized milk from cows, sheep, and goats. And I know it's so easy to list these like 50 things, 20 things. However, just implementing 1 or 2 of these into your producer's farm or as a veterinarian is very helpful. We know that some of these are not going to be achievable, but working towards implementing these will make us, safer. So what are our roadblocks in controlling Q fever? We have no vaccination option in the US for animals or humans. We have a lack of awareness of the disease by medical professionals in human and animal medicine. You look at Cricket's case and others that are just like Cricket, it took them forever to get diagnosed. It took them forever to get a doctor who understood that Q fever should be added to that list. So getting more awareness out to the medical community saying, hey, put this on your list if you have farmers or people who work around livestock. Additional research needed on antibiotic use in the management and control of abortions and shedding in ruminants, and a need for new testing methods for identifying subclinical infected ruminants prior to giving birth. And any researchers on this call, USDA has NADPREP grants available to you. And if you have an interest in doing Q fever research, we would be very much interested in it. We take NADPREP grants once a year, and then we read over them. And so we're always looking for grants that will further the sheep and goat community or the ruminant community in general. So VS's response goals to an outbreak in livestock include limiting the spread of disease in sheep, goats, and other susceptible species, educating and assisting state animal health partners and other stakeholders, and biosecurity, PPE, and control procedures to prevent the introduction and spread of Q fever, and partnering with public health agencies by conducting epi investigations, sharing information, outreach and education aimed at recognizing, understanding, and addressing health threats from the zoonotic disease. So that's where our team kind of comes in with the USDA sheep and goats. You would reach out to myself, and then I would work with you and your team to figure out what would be the best response for that producer or within your state. I do want to mention right now, again, I know it's state dependent how your state reacts to these cases, or even if you're collecting this data, but we're always happy to hear from you and help in any way. I know personally, I've been reached out to by many private practitioners and producers themselves. The producers are always very scared to want to talk about it with others. Like, I give them that safe space to talk about it. But when I ask if they want to talk to other producers about it, just to have someone to talk with or to share their concerns with, they're afraid to do it because they have highly prized animals and they don't want it getting out to the community or to other groups in the country that they have Q fever on their farm, because they don't know what that means. They don't know if they need to kill their animals. They don't know if that means they can't sell their animals anymore. And because of that, that's why I wanted to create an outreach and awareness kind of toolkit for Q fever, because we have so many people that are getting this on their farm but not knowing what to do. And then we have producers like Cricket who are getting diagnosed months and months and months later after he's, been bedridden. And so there's those two key factors and wanting to kind of pull this all together. And so recently I wrote a grant through USDA and I received some funding to create a digital media toolkit for stakeholders. And so the goal is to promote One Health through education and collaboration on Q fever. And so that's where you guys kind of come in today. And this is my call to action to get you to help me do this so that we can help others in the community. So our APHIS outreach and awareness activities, we want to create visual media. So developing videos that can be used as an outreach and awareness tool, like putting them on YouTube, putting them on our website. A toolkit, creating handouts and guides for general public and veterinarians in the field so they know the answers to these questions that they have, so that when their producer comes to them and says, hey, I don't know what to do, I have this disease, what's the next steps? We have that toolkit to say, okay, here's your options. And then also to collaborate. A lot of times USDA APHIS, we do collaborate as much as we can, but there are parties left out. And so this is the time now for you to collaborate with us if you've had a desire or need to want to do something with our group. We'd love to get your input and guidance on this zoonotic disease. So who can we model our toolkit after to achieve success in education? So Australia is a major contributor to Q fever research and outreach. And so in just doing research for this webinar today, I found so many resources. They have a toolkit already created. So Q fever prevention, what is Q fever? And these are handouts that go to their producers, their veterinarians. They've created an amazing video that walks you through what Q fever is from the veterinarian standpoint, the producer standpoint. They have handouts related to dairy goat herds, to wildlife and pests, the environmental spread, and what other collaboration that they're doing. And so this is kind of would be my vision for a toolkit. And we have the resources to do it, and we have the time to do it. So that's why today, one of our big asks is asking you, what else can we be doing to get awareness out there? So if you'd like to get involved in outreach efforts, please let me know. We're looking for academic institutions, public health veterinarians, medical professionals, or other subject matter experts to help create these outreach materials. And when I say create, it's really more giving guidance and your thoughts or concerns on how we're moving forward with it. Not a big time-consuming item, except for just letting me hear your story and what you're thinking. So our Q fever resources that we've used in this webinar and ones that are out there, we have Q fever, Are You and Your Farm at Risk? That is the Hordes Dairyman paper. We have Paul Plummer, who's published a few articles. We also have the Center for Food Safety and Public Health through Iowa State that has great materials, and we have our AASRP Biosecurity Toolkit resources. If you're a private veterinarian or a public health veterinarian, I'm happy to send you our VSG Veterinary Services guidance on the response to the C. burnetii outbreak. That's an internal guidance document that kind of can help you guide what to do during these cases. For more in-depth information on Q fever, this paper was already mentioned through Dr. Lombard, so I'll just move on from that. And so thank you for your time tonight. I'm so happy that so many of you attended and were here and are asking questions. I appreciate the comments that you made about Cricket telling his story. I think it's so brave for him to get on here and talk about it and spread that awareness, and to be the advocate that the industry needs. So thank you guys today for attending.
So with that, we can move into questions that have been posed. We've got several in here. And I'm going to turn it over to Dr. Ringler.
Yeah, thank you guys for all of your questions. I see that some of them have already been answered. I have a question about sharing the link to our research paper. I can definitely share that link with you, and it will be in the presentation. But also, if you Google Hordes Dairymen, comma Q fever, it should pop up. And then we have, are most exposures in people tied to cattle or small ruminants, or is it mostly unknown? The research out there believes that it's mostly tied to small ruminants. However, again, we still need to do more research to understand this. You saw Jason's data that he submitted about unpasteurized milk and how it's in there. So I think it's still mostly unknown, but the Australian government has pointed towards small ruminants as being the main cause. Have there been any discussions about surveillance testing in slaughterhouses with USDA FSIS? No, I don't think so. I think mainly, again, politics always play into that. And maybe it could be something that we could discuss further if you're with FSIS. Q fever is not, unfortunately, a priority disease for our agency. It's important to us and we want to educate people on it, and we have VSGs. However, that's not where our funding and efforts go towards. And so for me to get this grant through USDA is big movement towards making this more known. Okay, we have, while we have the experts on the phone, is there specific guidance or recommendations for interventions to or protecting slaughterhouse employees from this? To raw meat wasn't considered a transmission pathway, so would most of the risk be at the pre-slaughter area and removing of the organs? Yeah, I think for the most part in the slaughterhouse, it would be where, the organs are being removed, and you have that splash of fluids. And so I think that slaughterhouse employees, I think not, when the animal gets stunned, that's not really at a risk. But I think when they're moving through the process and that carcass is hanging and there's chances for fluids to be thrown onto someone, they're definitely at risk. Again, I don't know those numbers also of slaughterhouse employees and if they, are being tested for Q fever or they have titers to it. As USDA employees, we are tested just in, like Allison was saying, she got herself tested after she had some lung issues. I think it's surprising for many of us to find out that we do have titers to it. I know I have titers to it, and I was shocked. What defines a small, medium, or large goat herd? I think, Allison, that question is for you.
Yeah, let me look that up real quick. This is the part of the study that I'm less familiar with, but I'll look that up real quick.
Okay, and I do want to thank Allison for jumping in and helping with this webinar. Dr. Natalie Yuri was unable to attend due to a family emergency, so it's great that Allison was able to step in and kind of help us out. Do you recommend increased surveillance from the clinician for C. burnetii testing on farms? Do you recommend increased surveillance from the clinician? I think I would recommend that if clinicians are, working on these sheep and goat farms and are seeing increased abortion rates, they should be asking their clients, hey, can we send an animal into the lab for testing for the whole panel of abortion reasons? Now, I know that's difficult in a lot of circumstances due to the fact that getting an animal to a lab is not always easy, especially if you're like the middle of Texas and you don't have a lab to get to, or even in Pennsylvania where I live, it's hard to sometimes get an animal 3 hours away. So this could be at least conversations that you have with them that says, hey, can we take blood serum instead? at a later point, can we do some surveillance while your animals are, prior to them kidding to see what's going on? Okay, Allison, this one's for you again. Were any farm demographics related to seroprevalence, such as size or proportion of adults versus non-adults?
No, that didn't show to be statistically significant.
Okay, how about cow manure used in gardening? Honestly, I don't know how to answer that question. I think that there would be a risk if you're, possibly if you're gardening without gloves, but I'm not really sure about that one. I don't know if there's been a lot of research done on that one. Okay, hi, Elisa. Is there any clear value in knowing of our titers for those of us who have likely been exposed in the absence of Q fever symptoms? Yeah, honestly, I personally, as a woman, I think there is because, if we are trying to have kids and we're not able to get pregnant, it could be a good reason to know why. And that, that causes infertility in women. So from my standpoint, yes, maybe from a man's standpoint, no, but that's how I think about it. Was there any testing of mice, rats, or other animals that could be affected by Q fever during the goat NOM study? Allison?
Sorry, can you repeat that?
They want to know if there was any testing of mice, rats, or other animals that could be
No.
affected. Yeah, no. These studies are highly involved. I led the goat NOMS study in Pennsylvania, and there are just so many tests that we take during that NOMS study, not only for Q fever, but we're doing a parasite testing, respiratory diseases, whole slew. So
I do have the answer for the small, medium, and large. Small was 5 to 19, medium was 20 to 99, and a large operation was considered to be 100 or more goats.
okay, thank you, Allison. Approved disinfectants for premises instrument disinfection. Yeah, I do have an answer for that. We actually have those in our VSG. So if you would like those, just send me an email and I can get those to you. We have a whole chart. Do you recommend veterinary teams and producers with close contact with livestock carry a card of potential infectious agents that are exposed to help human doctors with differentials? Yeah, I think that would be an amazing idea and could be part of our toolkit. I know I'm updating the USDA website currently, and it will include a better viewpoint of all of those diseases, and it can be printed out. And as practitioners, we could carry it with us to say, hey, these are all the things that you could be potentially exposed to with your animals. So that is actually in the works right now with our USDA website team. Is it possible to treat a ruminant so that they can clear the infection? Guessing not. Yeah, I don't think that they can really clear the infection, but I think we can find out if they're shedding. And then if they are shedders, we could, consult with our clients and say, hey, maybe get rid of this animal. What speculation on Q fever prevalence in beef cattle herds does the team have? Dr. Lombard? What speculation on Q fever prevalence in beef cattle herds does the team have?
I have seen no studies that have looked at Q fever in beef cattle. I don't know if anybody else on the call has heard of that, but in my research, I haven't seen any.
Okay, yeah, Jason says that the research is limited in that field, so we're unsure. Okay, for the last question, is an affected premises a fool's errand? Yeah, I can see where you're coming from with that. I think if you know it's in your environment, at least you know how to move forward with your farm. Hey, I'm not going to have my grandmother on the farm with the animals. She may get exposed. We're not going to have these people that could be exposed to it. We're going to know that our animals may be exposed. And if we have a higher number of abortions, we know possibly why. You're right. It's hard to get it out of the environment.
I have
Okay.
a quick follow-up to another question that was asked earlier about
Okay.
the seroprevalence. I pulled up the paper just to make sure what I was saying was correct. And they said that, or they being the authors, there was no significant difference in the percentage of operations for seropositive C. burnetii by region, primary production of the operation, primary land facility type. but there was a difference in the operation size with 11.6 of small, 30% of medium, and 61% of large operations having any seropositive dose. So I apologize for that miscommunication earlier.
Thank you, Allison. And then our last question that we have, just talking about association of Q fever abortions in small ruminants with other abortion. And then do we have any idea of the human occurrence of CAMPy and chlamydia and SR producers to compare with? I think those are great questions to be asking. And again, the research is limited in this field. I know as a personal practitioner and working for USDA, I've seen co-infections of Q fever with other diseases, and it's always trying to figure out, okay, which one came first? What is the reason for the deaths? And so again, because of the limited research and money in small ruminants, we are unable to always answer all these questions. And again, that's why we want to put this at the forefront. And in terms of the agency commitments, this is one that will be committed through our agency for the next year because of this grant that I received. And secondly, because our administrator is really on board for wanting to get this figured out for the sheep and goat community. So again, thank you for your time. And if you guys have any follow-up questions or want more materials, just reach out to me.
Yeah, and this is Dr. Toring again. We'll go ahead. We've come to the end of our questions. I want to take this opportunity to thank our panelists today for the fantastic and presentation about this important topic. I think it was brought together very well with Cricket's story and then the USDA aspect and the various studies that were presented. So well done to our panelists. And again, a lot of applause, heart symbols floating up on the virtual webinar here. So thank you. I'm going to turn it over to Dr. Stephen Castle for one moment to make a comment about our continuing education program. Stephen is the chair of our continuing education committee.
Yeah, thanks, Eric. And I would just want to add my 2 cents in. I thought the presentation went very well. I really appreciate the way that you brought not only the research aspect, covering the disease itself, and then Cricket, thank you again for your story. And it really brings home the importance of what we do as veterinarians and as public health officials. So just want to make sure everybody knows that we've got some other good lineups coming up for the CE webinars, including a feline vaccination update, some information about gender and workforce development, and some other zoonotic diseases such as brucella coming up in the summer. So if you have any topics that you'd like to see, please send that over our way and we'll try to find the speakers, or even better, if you have a speaker that you have in mind that you think would do a good job for these webinars, then please let us know that as well. We had almost 200 people here tonight, so I thought it was very well received. Eric, that's all I have from here.
Thank you very much. And I'll close out today unless any of our speakers have any final comments. I'll give them a few seconds. Okay, hearing none. Thank you again to our speakers, our panelists today, and thank you everyone for attending. I want to wish everyone happy holidays, and please have a great evening wherever you may be in this world. Thank you very much for your attendance.